Welcome to another edition of AHYSEN Nation. It is so glad to have you with us again on this Tuesday. I was off last week, did a little cruising, and I'll tell you all about that because there are some things you need to know so you can feel comfortable now that the New Orleans ships are now going back out. Had one sail this past Sunday, so everything's cool there. I went out of Florida, so there was an airline trip involved, an airport layover. I'll tell you all about it, but I don't want to keep my special guest waiting. We have Erin Fulbright. She's the Executive Director of Sickle Cell Association of South Louisiana. Got a big event coming up this weekend called Ryan's Run, and we're going to find out all about that right now. And I think, Erin, you've even got a special guest. First of all, good morning. How are you?
Good, how are you?
Not a complaint in the world. Okay, so this weekend is Ryan's Run. It's coming up at Galvez Plaza downtown, and that will be Saturday. Pick up your packets Friday afternoon, and the location is to be announced as on my sheet. Where would we pick up our packets for the Saturday event?
Yes, so our race pickup is Friday at our office, the Sickle Cell office, and we're located at 2301 North Boulevard, right behind the Cats bus.
Oh, okay. Right behind the Cats bus facility. I know exactly where that is. Let's start off by talking first, and I want you to introduce your guest, talking about sickle cell. What is sickle cell?
So my guest is Gabriel Campbell. He is our ambassador, and he's one of our clients, so he's our race ambassador. Sickle cell is a inherited blood disorder that affects the red blood cells in a patient with sickle cell. It makes their blood sickle, so it's shaped like a C almost, and it gets hard and sticky, and so it makes it hard to flow through and get oxygen to other areas through the body that needs the oxygen to thrive.
If it makes your blood hard and sticky, are sickle cell patients more apt to have problems like stroke?
I'm sure stroke is one. I don't want to say for sure. I'm not sure on that, but they do have other areas like pain crisis. It can affect other organs, lungs, all of that we need our red blood cells to send those oxygen to. Gabriel, you want to explain what the pain crises are like? Speak loud.
The pain crises are like they sometimes they're all the time, they hurt and they stick in your blood. Well, in your blood passage.
So are you in constant pain?
When the pain crisis happens.
Mm-hmm. Mm-hmm.
So he's saying only when pain crisis happens. So it's not all the time, but they can have triggers. The weather can affect it. So if it's cold, if they're dehydrated, stress can bring it on. And those will cause the pain crisis where it will cause pain in the legs because blood's not flowing through to those areas.
Is sickle cell an inherited issue, or can you catch it later in adult life?
No, it's inherited. So one of your parents have to have at least the disease for you to get it, or the trait.
Can you have the trait or have the I guess, what is it, a gene, and not have sickle cell?
Yes, so we have patients that have the trait, and so they don't experience any pain crisis or any issues at all. When you have the trait, you just want to be aware of your partner, because if they have the trait, then your child's more likely to have the disease. It's good.
Go ahead.
Status. I was just saying it's good to know your status.
Is this a life-threatening disease? Does it shorten your lifespan?
Yes, it can shorten your lifespan. Research has been developed over the years, and we're having patients that are living longer because of medication that has been developed. There's blood transfusion, there's gene therapy, and there's bone marrow transplant that some people who have had bone marrow transplant have said that it's gone away. So there isn't a known cure all the way around right now, but there's research and things that are being developed to help with the disease.
Aaron, is this a African American disease only, or can anyone have sickle cell anemia?
Anyone could have it. It mainly does affect the African American community. The Hispanic population are the main ones that are affected, but anyone can have it. Just if you have trait, the parents have the traits.
Tell me about the organization that is. How long has it been in existence? How long have you been the executive director? It's the Sickle Cell Association of South Louisiana. Talk a little about that.
Yes, so I've been with the organization for a little over a year now. We started out as the Baton Rouge Sickle Cell Anemia Foundation, and we were started in the 1970s. We recently, in 2018, changed the name to South Louisiana Association of Sickle Cell Association of South Louisiana. We changed that in 2018 because we expanded our service to cover patients in Lafayette and New Orleans. So now we cover all of those areas, and we provide care coordination for patients with sickle cells and their families, their caregivers. So that's financial assistance, support groups, transportation, help with their prescriptions, because a lot of the prescriptions are very costly. And then anything else that they may need, we're here to help be that liaison, work with their doctors, their employers, so that others can understand exactly what they're going through. With the pain crisis, it may have you down, so you're going to miss school or you're going to miss work. And so we help educate those areas so that they understand what our patients are going through.
This is fascinating to me because I don't know a lot about it, and even your sign back there says there's a lot you don't know about sickle cell anemia. Can you develop symptoms later, or do you always know you've had it from birth, or can you develop those symptoms later in adulthood?
Well, you can develop the symptoms later. I believe, like Ryan Clark's story, he had an episode where Ryan Clark, the former LSU and Steelers player, and who the run is named after, he had a crisis when he went to Denver because of the high altitude and played. And then that's where he discovered some stuff. I'm not sure if he knew that prior, but you can develop stuff later in your adulthood. But after 1990s, they started testing newborns. So every newborn is tested for sickle cell disease. So you are aware that parent is notified once their child is born if they have the trait or the disease. So that way we can get in contact with them early on and help them, so to make sure that they have that care coordination with them throughout their lives. But earlier than the 90s, there was no testing. So we're still kind of finding clients that are older that may not have known or know about us to educate them and get them involved with us.
So at birth, it can be determined if you have the trait or if you have the illness. But if you have the trait, doesn't necessarily mean you're going to develop the illness. But if you have the trait, can you develop the illness later? I'm assuming you could, right?
Yes, certain triggers, and I guess it just depends on that person if it develops. But some don't have any crisis at all or anything that ever develops. And again, they just have to be aware of that they have the trait, so that when they do find a partner and when they are trying to have children, that they know if the partner has the trait as well, because then your child is more likely to have the disease.
Talk to me a little bit about Ryan and Ryan's walk. Why Ryan's walk?
So Ryan got involved with our organization, I believe it was 2017-16. I'm not exactly sure when he jumped in, but because he got involved with sickle cell after his episode in Denver that I spoke about when he was playing with the Steelers. So he's been involved with our organization since then. We love having the name after him. He's such a great supporter for our organization. I honestly don't know where it started, the Ryan's Run, why we went with the Ryan's Run for the fundraiser, but it is a great time for us to get together with our clients, get out there and walk in support of sickle cell awareness. September is Sickle Cell Awareness Month, so it's just a bigger reason to get together and walk. And part of managing your sickle cell disease is a healthy lifestyle and being active, not overexerting yourself, but being active, staying hydrated. So I think it's a great fit that we do a walk and get our clients out there together.
That was another thing I was going to ask you is that, you know, there's no cure for sickle cell anemia, but are there things that can help you manage your disease, and can you live a normal, healthy life with sickle cell?
Yes, like Gabriel always says, is he's just like everyone else. He just may, if he gets tired, you know, when playing at recess or with his brothers, he just will have to sit down and take a little bit of break. He stays hydrated. He drinks lots of water, right? All through school, yes.
Mm-hmm.
We help provide water for him to make sure that he has water throughout the day while he's in school, because that's very important. So, yes, you can live an active life, in a normal life. And like I said, they're living longer. People with sickle cell are living longer because of the medication that we have, and then the research that is developing and how we are helping them manage their lives. So eating the right nutrition, staying hydrated, seeing their primary care doctor, their hematologist, staying up on all of that when there's an issue, that we address it right away, and staying active and finding ways to not stress out, because having stress or being stressed can cause a crisis to come on as well.
So the run is this Saturday, the walk run. It's a 5K at Galvez Plaza downtown. That's kind of where Live After 5 is in the spring and in the fall. What time do we meet up down there?
So registration opens at 6:30. We will begin our warm-up around 7:40, and then the race will begin at 8 o'clock. So we'll take, our route is downtown around the Capitol and back to Galvez. And then we'll have a program where we'll honor our sickle cell warriors, and Gabriel as our ambassador. We'll do a butterfly release for those that we lost due to sickle cell. And then we have vendors out there and just gathering music, just gathering with our clients we haven't been able to see in over a year. We're still practicing safety guidelines with our masks, hand sanitizer out there and all of that. So we do ask that everyone wear their mask when you're not out on the race and we're gathered, but we are outside and we're excited to see all of our clients and supporters.
Now, I know the registration has already closed, but are you accepting walk-ups? And if so, what is the registration fee?
Yes, you can register at the race at 6:30. Your shirts aren't guaranteed size. I just want to point that out, but we should have extra. It's $40 on the day of, and we are accepting only cash and check, because we won't have, you know, that credit card reader. So if you can do cash or check, but yes, you are welcome to join us on race day.
You know, the gang in the WAFB Storm Center said this weekend's going to be fantastic weather-wise. So it's going to be nice, cool, and comfortable. Lower humidity is what they're telling us. So that's going to be fantastic for our racers. You didn't have a race last year, I don't think, right? Because of COVID.
We did a virtual, so we had everyone run virtual. We did gather for a blood drive downtown, and so we just streamed that through Facebook. So we didn't get to see everyone, and it wasn't the same. So this is back in person. We are going to have our host, Scotty Hunter, who's with the WAFB. He's been a good supporter of the organization, and Latangela Faye of Max 94.1, and our title sponsor, Louisiana Healthcare Connections, will be with us, and it's just going to be a great event. So I'm glad the weather is going to be awesome. I was praying for that.
We are constantly involved in blood drives around the city, and blood supplies are always in need of replenishing. And it wasn't until March, I believe, March or April, that I realized or learned, possibly for the first time, that sickle cell patients often need transfusions. So that's another reason to donate blood.
Yes, a lot of our patients do receive transfusions because, you know, their blood with the sickle bloods will get sticky and clogged. And so they'll get that fresh blood, red blood cells coming through. So a lot of them do rely on blood transfusions to manage their crisis and their condition. So we will have a blood drive out there as well. The Capital Area Omega Fraternity is hosting that for us. And we've also partnered with Our Lady of the Lake Blood Donor Center, where you can go in and donate at this whole month and mention Sickle Cell Association of South Louisiana, and that can help some of our clients to go in for blood transfusions or to be credited back to their medical bills.
So the money raised in your annual race goes to the Sickle Cell Association of South Louisiana, of course, and you said that it goes toward helping the patients and things like that. Does any of the money go to research? And is sickle cell researched? Is a cure being looked at?
Yes, it is being researched. Our funds currently don't go to research, but we work with organizations and universities on research and how we can get our clients involved in that too, to help develop that research along and see what works for our clients. A lot of our funds goes to our programs with the hydration program, providing water for our clients that need it. Like Gabriel needs some at school so that he can stay hydrated throughout the school. And right now they don't have water fountains because of COVID. And then just providing Gatorade for our clients through that hydration program. The financial assistance with medication, we've helped some clients with that. So the funds go towards that. And just anything else care coordination wise for our clients to make sure that they can keep thriving.
Aaron, what is the biggest risk for a sickle cell patient as they walk through life?
Staying hydrated, not staying up on their care, letting things, slip through that. That's why one of our biggest thing is having that primary care doctor, because if you're not treated and being monitored regularly, things can slip through because of how sickle cell can affect the other organs. So really that hydration has been a key that I have learned, finding a hematologist as well, which we do lack a lot of hematologists within our state. That is something that our organization as well as other organizations throughout the state are working on, is just having more doctors that specialize in sickle cell disease, and helping us make sure that all of our clients have a doctor that they can go see. And the doctors that we have aren't overwhelmed. We have quite a few here in Baton Rouge, New Orleans, and Lafayette that we work with that are great. But, one person can only do so much too. So that is definitely a key thing, I think, outside of just maintaining their health, making sure that they're right, is having the resources for our clients here in the state, in our city, with medical care and the hematologist to help them.
How can we get more information about Sickle Cell Association of Louisiana, and how can we support the organization?
So you can find more information about us at SCASL.org, our website. We're on Facebook and Instagram as well. Connect with us there. Helping us out is making a donation, participating in Ryan's Run, doing a blood drive, donating or doing a drive for water and Gatorade for our hydration program. Those are ways to help get involved with us and support our sickle cell clients, and definitely learning about sickle cell. So research, if you know someone who has sickle cell, talk to them to learn a little bit more about what they're going through, so that you can be understanding.
Wow, that's just fascinating. There's so much to know and so much that we don't know, especially, people that are not affected, people that are not African American, often don't even think about this. And this is, from what I've read before this visit with you, that this is one of the most common blood disorders in the world. I didn't know that.
Yes, there's over 100,000 people that does have sickle cell disease. It's just not talked about. You know, you have cancer that you know, more people know about cancer, but not a lot of people know about sickle cell disease. And it might be just because it doesn't affect everyone like cancer does. But we just, our main goal is to bring that awareness so that everyone understands sickle cell disease and what our clients go through as well.
Is Ryan's Run your biggest fundraiser or your only fundraiser? How else are funds made available to the Sickle Cell Association of South Louisiana?
Yes, that is our only fundraiser as of right now, and our biggest one, of course. But we do have a lot of loyal supporters that have been donating monthly to us that we appreciate because they help keep us going outside of this fundraiser. And then a lot of people donate Gatorade and water for us, which is awesome because our clients really need that. But right now, Ryan's Run is our only fundraiser outside of us just getting those special donations that come in throughout the year.
Anything else your guest would like to add to our visit today before we hop off?
You want to say anything else? Encourage them to come out with us?
No.
He'll be out there, huh? You'll be out there this Saturday, right?
Yes. Yes, they will be out there, and this is our, you want to lean back? This is our Ryan's Run shirt that he is wearing. So this is what comes in our race. So he'll be out there.
KNEAU, no sickle cell. Is that right?
So that is our kind of campaign through this year's no sickle, because we want more people to learn about sickle cell, to understand it, to at least know what it is when you hear sickle cell disease, that it's an inherited blood disorder, that you can't catch it, that you're born with it, and to just understand what our clients are going through. And if you can support us, support our clients, come out and enjoy the walk with us.
Man, that's going to be a lot of fun. And of course, WAFB Scotty Hunter will be out there this Saturday, Galvez Plaza. And the race, again, give us the specifics, times, and all of that, when to pick up your packets. Of course, you can pick them up Friday at your office, but on Saturday, what time do we need to be down at Galvez Plaza?
Yes, if you're picking up, our registration opens at 6:30 a.m. We'll be warming up at about 7:40 a.m. and our race will begin at 8 o'clock a.m. And then we'll have a short presentation after, and just some music, some fun, a photo booth out there, and some great vendors that will be there, so you can enjoy a little bit of the afternoon or the morning with us before you kick off the afternoon and get ready for football.
Oh, that's fantastic. Erin Fulbright, you are a wonderful spokesperson for this association, executive director of the Sickle Cell Association of South Louisiana, and we are so excited to try to help you promote this event for you guys. And of course, like I said, some of us will be down there, Scotty for sure, and good luck with Ryan's Run this Saturday down at Galvez Plaza, downtown Baton Rouge. Erin, thank you.
Thank you so much for helping us get the word out and supporting us always.